You have given birth to your beautiful baby, and now you don't know what's happening to your body. Welcome to video 2 in our series on the first 2 weeks after birth. And today's topic is postpartum body. What is happening to me? Why did nobody tell me this? Welcome to motherhood. It's really beautiful. It's fun. I love it. But there are things that happen to your body after birth that nobody talks about. So that's what this is. We're going to talk about it. We're going to break it down. We're going to go through postpartum bleeding, postpartum hair loss, body odor, depression, anxiety, baby blues, all sorts of beautiful, beautifulness. Part 1. You've had your baby. The placenta's left your body. And no matter how you give birth, whether it's vaginal birth or cesarean section, you will bleed. Your body has gained 50% more blood volume during birth. It not only nourished a human being, it grew a whole new organ. Your body is amazing. It is amazing. But it's also retained all this extra fluid. And if you were in a hospital for your birth, most likely you got an IV, so you got even more fluid retention. Your body gets rid of this extra fluid in 3 different ways. 1, bleeding. 2, sweating. 3, peeing, right? So right now we're talking about postpartum bleeding. What is it? Postpartum bleeding is called lochia. It comes in 3 phases: rubra, serosa, and alba. And it can last anywhere from 15 to 51 days. Now, this does not mean that you are going to be bleeding like your menstrual cycle for 51 days, although sometimes you will, but it means that the lochia phase is up to 50 plus days. Now, rubra, that is the dark, heavy red blood that comes out of your body, and that typically lasts around 4 days to a week after birth. This is your body getting rid of that extra tissue. When it does the uterine contractions, it's pushing that out. It's getting rid of this blood that's in your body, and there's a lot of it that comes. You tend to need those really thick, heavy nighttime pads all day long, or even adult diapers. You want to buy special underwear for these first 2 weeks. It is very different from your menstrual cycle. With serosa, you're going to have a lighter flow at this time. It might be spotty even. Like it might not be a heavy, steady stream. It might be a little drizzle. And this typically lasts for 10 or more days. And then you enter the 3rd phase of lochia, which is alba, which is the white discharge, the mucus type of discharge. And that is like white blood cells and other things leaving your body. It often is cleared up by that 6-week checkup. An additional tip is to get a bed liner to place underneath your bed, because you might leak in the night, but you also are producing milk and you might leak from your breast at night as well. Now, I got this question when I did a short reel on this topic. Can I use a tampon during this time? And it is not recommended to use a tampon during the lochia phase. Why? Because your cervix is open. Whether you had a cesarean section or vaginal birth, it's going to be open, and your body is releasing all this fluid. You don't want to insert a tampon during this time because it introduces bacteria, which can lead to infection. And the last thing we want is for you to have an infection during this healing time. It also, if you had a vaginal birth, you might have tears inside, or like cuts inside. You might have suffered a tear, and this can cause even more infection and pain and dry it out as well. So it is not recommended to use tampons. Sweating, the other way that our body gets rid of this extra fluid that it's retained during our pregnancy and during the IV that you most likely got, is by sweating. You will typically find night sweats happen. In the nighttime, you're just drenched and you don't know what is happening. Your body's just getting rid of this fluid. Unfortunately, this also tends to kick up our postpartum body odor because of all this excessive sweating that we're doing. And it's a different type of sweat that gets deposited into our hair follicles that start to emit this aroma. But what's a cool thing about it is that our baby's sense of smell is so strong at birth that they are picking up our scent. And this body odor, which we are unfamiliar with, is actually a comfort to them. And it helps them recognize us even quicker, and it helps them, their nervous system, calm down because they know we're present. But please take a shower. It will pass. This is commonly found for the first 3 months, up to 4 months, but your body and your hormones will balance back out, and you won't have this stench about you forever. It's just for a season. I'm sorry. Postpartum hair loss. Before we get into this, if this video has been helpful in any way, will you just like and subscribe so that it can reach more mothers and it can help more parents navigate these first 2 weeks. With postpartum hair loss, during pregnancy, the hair follicles have stayed in almost like a stagnant state, and then when our hormones drop, it kicks our hair follicles into the shedding stage, and it starts to shed in abundance. Now, it's not common for it to happen in the first 2 weeks. It typically happens around month 4, and then you're just like pulling clumps of hair out, and you're like, what is happening to me? And you're really worried you're going to go bald. But it's normal shedding. Your hair follicles, you're going to have a lot of these like baby hairs, which I am 2 years postpartum, and I'm still like getting these hairs back. And like if you look here, there's so many up here. So it takes a while for your hair to grow back. You're going to have like different like patches of shorter hair in different areas, but you will not go bald. It is just a normal part of this hair shedding process that happens. Unfortunately, it just starts to all happen at the same time. It can be really, really nerve-wracking. So I just want you to know, it is common to experience postpartum hair loss after birth. Okay, the first poop. Typically after birth, you're not going to poop for the first 3 or 4 days. And if you've been given an opioid for pain, it could be even longer than that. Now, this is one reason why I highly recommend easily digestible foods for mothers, and I've included that in a link for you below, about 6 recipes that I love that are high protein, they're nutrient dense, they're easy to make, they are easy to eat, they can be cooked up in batches, and they're so easy for your body to digest. This way, when you have that first poop, it goes a lot easier. It is still scary because if you have a C-section, you have pain, you have loss of control over your core, you're not able to push the way that you used to be able to. If you had a vaginal birth, you might have had a tear, you might have had hemorrhoids from pushing now, you might be in some pain, and it can be scary. With the first postpartum poop, expect it to take some time. Bring up your knees to get your body in a better position for pooping. So whether you're bringing in chairs or books on the floor, expect it to take time. Get your knees propped up. Dab when you're done. Don't be wiping away because there's a lot that has happened down there. And then you can also use these spray bottles or even like connect a hose to the toilet itself to spray your bottom to clean it off. But take your time. It is scary. But once you do that first one, it gets easier and better after that. And it's a great sign that your body is starting to work the way that it's meant to again. It is worth celebrating. Hormone shift. This is a big one. I did not know this the first time. And it hit me like a wall. I had my baby. He was healthy. We had a really risky pregnancy. We were just praying he would make it. And I got him. And I'm holding him. And I am so sad, and I'm crying, and now I'm feeling guilty because I should be happy because I have my baby and my baby is healthy and I get to take him home. There's a lot that's happening in your body. One, you're going through this massive transition, which is a lot for anybody emotionally, but when the placenta leaves your body, the estrogen and the progesterone that has been rising throughout birth, and these 2 hormones are your sex hormones, and they are responsible for mood, appetite, sleep, memory, the feel good, the motivation. It takes an immediate nosedive. It crashes down to a menopausal woman level. This is a whirlwind of a time. Not only do you now have a new role you have a new human, your hormones have just shot down completely, and there is no wonder we feel so like, what is happening to me? 80% of women find that they feel this blues feeling for the first 2 weeks after birth, which is like, you're fine, and then suddenly you're crying all this, like you can't figure out what's happening, and then you're okay again, and then you feel so sad, and then you're okay, and then you're just crying and sobbing, and you don't know why you're crying, you're just crying. It's your hormones. This is very normal. A lot of us feel this. If this persists more than 2 weeks, and if you don't feel any joy, you don't feel any pickup, this is a sign of depression, not baby blues. And this is really, really serious and really important to watch out for. And so just take note of your emotions, take note of your feelings, talk to your family, talk to your support person, talk to your partner, let them know what you're thinking, let them know what you need, and be honest about it, because there is a lot of shame, there's a lot of guilt, and your hormones have taken a nosedive. All right, it is understandable for you to just feel so out of sorts, and most of us will feel better and more like, oh, okay, I feel a little bit more like myself, my mind is a little bit more clear after those first 2 weeks. So these first 2 weeks are just a whirlwind of sleep deprivation, hunger, pain, confusion, and gratitude and joy, and then crying. So it is a whirlwind. It really is. Like, it is just like this roller coaster ride of emotions and feelings, and it will pass. It will get better and better and better and better and better. Belly binding is a common practice in the East. It is becoming more common in the West, and it is taking this garment and wrapping it around your stomach. You can use like an ace bandage. You can use like this special cloth. I personally just used a Velcro hospital kind of belly band because it's easy to put on and it did the job. And what is happening is during pregnancy, your abdominal muscles have separated because your belly has grown out. And after birth, they're still like this. And so you might notice a lot of lower back pain. You feel weak. You feel disconnected in your core. You're like, what is happening? I can't control my body anymore. Your muscles need to come back together. This is done through certain exercises, not planks, not crunches, not weighted squats, not sprints, okay? It's slow, controlled breathing practices, and then hip lifts, and then glute slides, very slow movements, very gentle movements, and this will bring your core back together. But in the meantime, because you shouldn't be exercising right now, is to wear this belly band. It's going to give you better back support. It's going to help pull those muscles back towards each other so that you have more stability, you have less injury, you have less pain. Do not get a corset. Corsets are very dangerous during this time because your organs are trying to come back together into the places that they're meant to be, and your uterus is trying to shrink back to its original size. You don't want to be compressing your organs. You want to be supporting your core and supporting your spine. So I will link a couple different belly bands that I highly recommend below. They will be gentle, they will be soft, they're not going to be this stiff ribbed one. We want to stay away from that. Nothing with bones, nothing that's like firm. You want a gentle binding on your stomach to support you, not to compress you. We're in the process of healing. And the more intentional we are about our healing, the stronger you're going to get, the healthier you're going to be, the more confident you're going to feel. It is worth resting right now. Your body has done an amazing thing. It has worked so hard, and it is the season of rest. So rest. I hope this has helped. If this has helped you in any way, please comment, like below, and I'll see you in the next video where we talk about newborn care and parenting hacks. Love ya. See ya, peeps.